Hi, hope you guys have seen the previous episode on primary or first degree burns, and this episode is a continuation about second degree and third degree burns. If you haven't seen the previous video, you can find the link below. Hi, I'm Dr. Deepthi, consultant plastic surgeon, Eternelle Aesthetics, and today we are going to talk about second degree and third degree burns. These are more deeper burns in compared to the primary or the first degree burns. And what are second degree or third degree burns? Are they deeper burns? Do these burns happen to normal people in normal household situations? Yes, they do happen very commonly. As a normal layman, in terms of medical terms, you might not differentiate between epidermis and dermis and other tissues. For an expert, they will be able to appreciate on seeing whether it's a primary burn or a second degree burn or a third degree burn. When do these happen usually? Whenever the heat content of the liquid that's fallen on your body is extremely high, or when you had a direct flame injury, we might end up in a second degree burn, or in situations where hot oil pours over the skin. This also can lead to second degree burn because reducing the heat content of the oil is very difficult and it's not as easy as we reduce the heat content of the water. Even if you rush to the tap and put your arm under the running water, still the depth of the injury goes faster into the deeper layers when it's oil. So, in case you had a second degree burn, then what do? First of all, how do you identify if it's a second degree burn or a third degree burn? In any burn which is more than, I say suppose at least 5 to 10 centimeters in its width or diameter, please go to an expert for the consultation. Whether it's primary burn, whether you had pain, whether you didn't have pain, because the sequel of the burns can never be predicted and it's always better to take expert opinions. When you go to an expert, they will definitely decide and tell you what is the plan of treatment and they'll guide you through the whole process. Usually that could be a collagen dressing or cereal dressings depending on the size and width of the injury and the depth of the injury. Especially be careful, and you also should be very cautious when the injury or the burn is on the joint surface areas. See, a human body is very well modulated system wherein whenever there is an injury, the skin surface tries to heal in the smallest surface area. Say suppose we had an injury of around 10 centimeters. When it's trying to heal, it wants to reduce the area that it wants to heal. So it will heal in an area of 8 centimeters only. So especially if you have injuries or burns in areas which cover the joints, say palms or wrists or elbows or shoulders or any of these joint surfaces, then there's a continuous process wherein the wound wants to heal in a smaller surface area, like this. So, in case if you're not treated properly or you don't follow the treatment protocol properly, then your burn will definitely end up into something called contracture. That is wherein a thick tissue forms in the burned area and the joint surface will become like this, and this position is called flexion. It will be permanently fixed in this position and you won't be able to do any activity that the joint usually does. Usually a doctor gives treatment for around 2 to 3 weeks for deeper burns also, but what do we do after that? They will advise you for physiotherapy. In some deeper cases, they might give you splints wherein the joint is forced to be placed in this situation so that it doesn't heal in a flexion. Then how many days would you follow up with the case? Usually the healing time of a burn wound is nothing less than 2 years. So in case you had a burn on any of the joint, let it be even a finger joint, you will have to take care of the physiotherapy, go behind your doctor for a follow-up, and definitely do anti-flexion exercises for at least 2 solid years. Even if you leave it after 1 year, there's still a chance of forming a flexion, which is a continuous process of healing, and you might end up in a flexion, especially in smaller kids who have growing joints. In case you don't take care of these wounds on the joint surfaces, they will end up in flexion and the particular bone would not grow to adult size and they will have shortening of limbs, which we very commonly see in our practice. So always, whatever is the degree of burn, especially if the burns are in sensitive areas like joints or your private areas or the neck or any of these areas where movement is a primary function of that area, definitely don't take a chance. Even if it's first degree burn, even if it's second degree burn or third degree burn, stick to an expert who knows how to take care of burns. Follow the treatment protocol properly. Follow with your doctor for at least a period of 1.5 to 2 years till the whole possibility of contracture comes down. In case you already developed a contracture, how do we deal with it? Let me discuss that in the next video. Please stay tuned to Eternal Aesthetics. I hope you found this video helpful, and in case you feel somebody would be benefited with this video, please forward it to them. Share, like, and subscribe to Eternal Aesthetics.